Which thyroid cancer will present with a proliferation of parafollicular cells, C cells, that produce excess calcitonin? A. Papillary carcinoma. B. Anaplastic carcinoma. C. Follicular carcinoma. D. Medullary carcinoma. The answer is D. Medullary carcinoma. Medullary carcinoma of the thyroid originates from the parafollicular cells, C cells. Elevated levels of calcitonin in these patients cause diarrhea, which is the most common clinical symptom. Papillary carcinoma, follicular carcinoma, and anaplastic carcinoma are not associated with any significant elevation in calcitonin levels. What cancer presents with the following triad: hematuria, flank pain, and an abdominal mass? A. Mesothelioma. B. Ewing's sarcoma. C. Renal cell carcinoma. D. Hodgkin's lymphoma. The answer is C. Renal cell carcinoma. Hematuria, flank pain, and an abdominal mass are all signs of renal cell carcinoma, an adenocarcinoma originating in the proximal tubule of the kidney. Mesothelioma is a form of lung cancer associated with asbestos exposure. Ewing's sarcoma is a type of bone cancer common in children and adolescents, and Hodgkin's lymphoma is a cancer that originates in the lymphocytes of the blood. What is the most common type of liver cancer? A. Hepatoblastoma. B. Cholangiocarcinoma. C. Hepatocellular carcinoma. D. Teratoma. The answer is C. Hepatocellular carcinoma. Hepatocellular carcinoma accounts for approximately 75% of all primary liver cancers. Cholangiocarcinoma and hepatoblastoma are rare forms of liver cancer, and a teratoma is a tumor that contains normal-appearing tissues from multiple germ layers, which can appear in multiple locations in the body. All of the following cancers frequently metastasize to bone except dash. A. Prostate cancer. B. Lung cancer. C. Breast cancer. D. Stomach cancer. The answer is D. Stomach cancer. Breast, lung, kidney, and prostate cancers make up approximately 80% of metastases to bone. Stomach cancer can metastasize to bone, but it does so only rarely. The appearance of red, purple, brown, or black papular lesions on the extremities, back, face, mouth, and genitalia is a typical presentation for what malignancy? A. Melanoma. B. Pancreatic cancer. C. Burkitt lymphoma. D. Kaposi sarcoma. The answer is D. Kaposi sarcoma. Kaposi sarcoma presents with red, purple, brown, or black papular lesions on the extremities, back, face, mouth, and genitalia. It is caused by human herpes virus 8, HHV8, and is typically seen in immunocompromised patients. Neither Burkitt lymphoma nor pancreatic cancer typically present with any associated skin lesions, while melanomas tend to be singular lesions.